system using wearable device. Next, this is my introduction. Recently, what referred to of mobile computer technology, remote health surveillance. Systems have been used to capture, transmit, and analyze health information remotely, which have beneficial effects on patients' self-efficacy, self-management, and quality of existence. Then, patient monitoring provides a number of error sources, and it is important to use appropriate surveillance and measurement methods for accurate findings, as well as restricting and limiting the visibility of hospital surveillance. Then, therefore, in the creating insightness, however, monitoring may be performed from home. For example, if the appropriate implementation of measures can be assured that with population again in the West, more effective health service will be needed to ensure that the burden separated it is come an activity solution to free hospital bodies by moving patients surveillance to patients residence. Next, this is my methodology. 6 stage of the approach may be used the problem identification and motivation, goal definition, design and development, demonstration, assessment, and communication. Then the challenge of the issue, the knowledge of the recommenders of stockholders and the gap the technology can overcome the drive all this study to come up with the solution. Then the primary aim is to provide centralized effectiveness system to remotely monitor patients with the cardiovascular disease. Then we have shown the design by development of a remote multi-sign system and prototype. Then B, application of software and findings were assessed as follows. A, the result compares with the goals of addressing the knowledge body contribution. B, assessment by performing health expert survey. Then this is my flowchart. My flowchart: registration, medical record, alarm, emergency notification, appointment, telemedicine for doctors, observing patients. The first one, lifestyle, sleeping time, physical effect, body weight, and food habit. Then pain level on the on of 1.0 to 10.0. Then vital sign when pain is high or increases 5.0. Then next, the last one, drugs. Next, a framework. Patient at home should wear a sensor and switch it on. The sensor starts capturing the vital sign data and prefers it into its repository. Then, wherever Bluetooth connection is established with the PC, it starts downloading the data with the help of the SDK provided with the sensor. The downloaded data is raw data which includes information about different species of the sensors as well as the vital signs measurements. Then, patients need to be registered into the system before they can benefit from it. Next, the system has two sources of data. And the first one is coming from entering patient information manually throughout patient registration. Then, the second source of data is used sensors. Next, health-related data included vital signs, physical activity, posture, heartbeat rate, and breath rate. Then, the registration of patients begins by completing an authorized person on the web form by providing health number, complete patient name, gender, data of birth, maximum, goal heart rate, height, weight, phone number, patient email and physical telephone number are all the information needed. Data profiling implies that the system makes the patient pattern according to the response of the question given. For example, the patient is a smoker, the value of this question is S. Then the app connects to the immune system through the internet and collect information from the patient. The program will then be ready to process any recorded data. The sensor utilized in this study is the Biohandsys 3.0 developed by Zephyr technology, which provides both real-time monitoring and logging capabilities. Next, this is a table parameter of monitoring system, and this is my device I use in my paper. Next, conclusion: we designed a personalized mobile application health monitoring system for patients living with heart failure according to their health care and usability needs. Then, the system has already been discussed with medical doctors and they are in agreement to implement the system for patients' home monitoring, which could make some of their workers much easier while making the monitoring of the critical care more more comfortable for the patients during COVID-19 pandemic. Then the solutions seem promising when it combined with medical profile data. Better decision can be made, and a rating of emergency can be timely, which can help to save lives. Then, a future enhancement of the device, both in hardware and software, will make the device more robust and effective and continue home monitoring of the patients. Next, this is my reference.
Sorry, the time is up. Thank you, Mr. Ahmed, for the presentation. Now, I would like to open the Q&A session.
Let me ask you one question, Ahmed. Thank you for your presentation. Okay, because the project use wearable devices, have you considered something about energy consumption and privacy issue? Because wearable device may consume energy and it may store data, sensitive data, and the way for data transmission from the body to the computer server. Thank you.
Okay, welcome. I use this device because on this time about pandemic COVID-19, the wearable device connect with the mobile application. I would do that, but not a computer. The patient has the same application and the doctor has the same application. The connection between the patient and the doctor, this device, any patient has a problem with the chest or the heart disease, I will do that. Why do that? Because the COVID-19, you should, the doctor don't touch the patient. After the patient go to many things. When I stay at home, the doctor, when outside in the hospital, outside the home, the patient have problem or high pressure or high BP. You can, the doctor, see what happens with the patient. That's all.
Ahmad,
yeah.
What is the current result now you got from your work?
My result, I did questionnaire survey. I did that with inside my paper. You can I have 25 questionnaire and ask 45 doctors, medical doctors. All of them answer agreement with the questionnaire. For example, home monitoring improve access to healthcare service. And the next question, home monitoring save time traveling to hospital or special clinic. The third question, home monitoring provides for healthcare needs. I have 25 questionnaire. I ask him. Only I just explain the conclusion. I ask the doctor, medical doctors. Yeah. But I put in my web.
Do you have anything that can show from your slide for the result?
I can share my paper.
Okay, that one is in your paper, but not in your slide presentation.
Yeah, and slide only this in conclusion. I explain about what I ask the doctors, only the doctors, because I forgot this slide and put in the slide, but in my paper I did. Yeah, I can share now in my paper. You can see the result and questionnaire. Yeah.
Because I cannot see your system at all from your system, from your slide, right? So, but it's okay because this is a very limited time for the presentation.
Yeah, I know.
But you have tested so quite numbers of subjects, right?
Mm. Okay.
Okay.
Thank you.
Do we still have time for question?
Maybe for one question.
Okay, can you go to your framework, please, Ahmad?
What?
Can you go to your framework? What is actually that you monitor and what do you mean by wearable device?
The wearable device, hello?
Yes, please answer.
I use the wearable device. This device you can use the cable or Bluetooth with connect with the mobile phone.
Wearable, what do you mean by that?
Wearable device.
What is it? Are you developing that or people can just find from the market or how?
Yeah.
It's gonna affect on what actually the parameters that you are monitoring. Did you mention just now what is actually that you monitor?
You can just this device you can use with cable or Bluetooth and connect with mobile application. I choose that, but it needs the software or hardware.
What actually that you monitor?
Names of
What are the data?
My data. I did the data analysis with the questionnaire. After the questionnaire, I have data analysis. I put in all of them in my paper.
Okay, what are those? What that you monitor? That's my question, please. What that you monitor? What doctor monitor?
Mobile application.
Okay, you didn't answer the question. What are those data that doctor monitor the patient?
Yeah, mobile. Yeah, mobile. The mobile.
What you collect from the patient?
What?
What data that you collect from your patient to be monitored by the doctor?
Yeah, I get the mobile application, connect with doctor and patient. The connect between mobile application, the wearable device, wearable the patient. This I connect with the mobile with Bluetooth. When the patient has any problem and has low temperature, for example, the mobile application will get after that will send a message for the doctor. You understand me? Excuse me.
Right, it's okay. Time's up. You didn't actually answer. You did not answer. Thank you. Yeah.
Okay, thank you.
All the best.
Now we are going to see the second presentation, computer vision for monitoring the use of masks in the pandemic era. The presenter name is Mr. Ahmed.
Assalamualaikum. Hello everyone. I'm Ahmed Syaputra Nainggolan. I'm from the Department of Information System, Faculty Science and Technology, State Islamic University, Sultan Syarif Qasim, Riau, Indonesia. This time, I will present about my paper with title Computer Vision to Monitor Face Mask Use in the Pandemic Era. This is the table of content. The first is introduction. The second is literature review. The third, methodology. The fourth, result and discuss, and the last, conclusion. Introduction. The spread of coronavirus disease or COVID-19 in Indonesia is still high and has not saw a decline. The last data state that total confirmed research 3 million patients and additional research 40,000 patients per day in Indonesia. It is due to many parents in carrying out health protocols, especially in using masks. However, there is a lack of supervision by the authorities, which has led to various health protocols. Based on CNN Indonesia report, President Joko Widodo in July 2020 said 70% of each Java residents did not wearing masks during their activity in public place. We have solution from this problem, and computer vision technology there is one of solution. We know that computer vision technology has capability like visual recognition capability, such as recognize object and in an image. Computer vision use a security system with a scanner, identify facial expression, traffic violence detector on highway, and many more. And one of the famous computer vision algorithm is convolutional neural network. So in this study, the author make an application user mask detection with the CNN algorithm. The second is literature review. This is on CNN algorithm for image classification has been carried out, such as in classification of foreign character with 200 foreign image data collected from Google search engine, and this result classification accuracy with 98%. Another research by answer that is classifying mass user using CNN based on the mobile finance architecture. On this study, they have 1,076 image data with 90% training data and 20% testing data. In the study, the model produced an accuracy of 91%. The methodology. In the study, the first step we have to do is data collecting. Data collecting is collecting data from the Kaggle.com repository, which data is from a group of an image people pass totaling 1,000 image, which divided by two types is the use mask and not use mask. And then data pre-processing. Data pre-processing is a step in the data mining. Is the analysis data process to take raw data and transform into a format can be understood and analyzed by computer and machine learning. In the data processing, we have to do is grayscaling, digitalizing, resize, and normalizing in the data. We have seen the picture of the presentation. And then in CNN architecture, the CNN architecture of the plot on CNN in this study developed by Purwaningsih in 2019. The process of the input of this process is an image has been pre-processed pre-processed in the previous stage. We see the image is the CNN architecture developed by Purwaningsih. And then is training. The training aim to train the CNN architecture and recognize the data set and build a model. And the last is testing. The testing is carried out measure the accuracy of the model and classify a new data in addition to training data. Testing with the image data is done by testing the model of the test data which among 100 data and has been shared in the previous training process. In this picture, training scheme. We have the training data and the CNN architecture, and then model fitting, and it has model CNN, and this is training accuracy and loss. And the side is validation, the data, version data, model CNN, and have the validation accuracy and loss. The fourth is result and discounts. The training process is carried out by several experiment scenarios, namely by comparing the several parameters in the CNN architecture, such as number of epoch, validation speed ratio, learning rate, and image size. And the result of the training, the best model is achieved at parameter 20 epoch value, 90 by 10 validation split ratio, 0 by 001 learning rate, and 150 by 150 image size. And the testing in the real time on Zanapa bookstore, Pekanbaru City, the result of test carried out on 20 soft visitors. And here the application has successfully detected 90% correctly, and there is only one false of them. And the last is conclusion. The research has successful implementing the computer vision technology with a convolution neural network classification algorithm. From a series of training process, the best model is obtained with the parameter 20 epoch value, 90 by 10 validation split ratio, 0 by 001 learning rate, and 150 by 150 image size. While the testing with image input produce 99% accuracy, while real-time accuracy of input the camera produce 95% accuracy. This application can be developed with a detection feature to keep a distance or body temperature sensor, so that later the monitoring of health protocol can be fully carried out by. So that later the monitoring of health protocol can be fully carried out by using a machine. So this is my presentation. Thank you for your attention, and thank you.
Thank you for your presentation. I would like to open the Q&A session.
Okay, thank you for your presentation. And the topic is quite interesting, and it is trendy for during COVID pandemic crisis. Let me ask you some question about the result, because you said that you have studied and you test about 20 samplings, right? Do you think it is too small? Because only one error, right? Only one error out of 20 or 19, and you claim that the accuracy is 95%. Do you plan to further the research, or why you choose only 20 people? And you said that only one person is detected as error. So can you investigate why the error happens?
Yes, I tested two model, two schema of testing. The one is to testing from an image, and the one is a real-time testing. In the image testing with the 100 image, there is the accuracy is 99%. And on the real time in the bookstore with 20 people, it is accuracy 95%. So I have two model of testing of this. Okay, sir.
Okay, thanks.
Ahmad,
Yes, sir.
is it YOLO based or what?
No, it's
Is it YOLO based?
based on CNN architecture standard architecture from CNN.
Or you use a standard from CNN?
Yes.
You are not using YOLO.
No.
You use training. You use from website or you use another type of training?
Can you repeat, sir?
For the data training, you use website training or you use from your computer training?
Oh, my computer training.
Or use computer training?
Yes.
All right. Have you tried Tiny?
1,000 pictures. 1,000.
So 1,000 you train the data based on 1,000 and you can get 95%.
Yes.
But that one is because of you use the standard neural network.
Yes, standard neural network.
And what kind of camera you use?
I use a webcam and smartphone camera.
Smartphone camera.
Yes.
Okay, quite impressive because you just use standard, then you can get 95%.
Yes, sir.
Okay. But you don't have applied to any system yet, right? That one is direct to your computer, right?
Yes, my computer.
Okay, right. Okay, thanks.
Thank you, sir.
Okay, one more question. Your project is to detect, right, not recognize.
Can you repeat, sir? What?
I mean your project is to detect the face with mask, but not for face recognition, right?
Yes, the only mask and no mask yet. There's no mask.
Okay, just face, just mask and without mask. Okay. Thanks.
Yeah.
Maybe no more question. Yep.
Okay. The third paper presentation named Light, Raise in Microplastic Pollution Due to COVID-19 Pandemic, a Review, presented by Dr. Shamila Azman.
Assalamualaikum and good day to all. My name is Farhan.
Technology here. Today I would like to present Rise in Micro.
Sorry, would you like to present it live?
No, I prefer video. Actually, I just want to say that I'm presenting on behalf of Dr. Shamila, and I will try the best to my session. Can present video, right?
Yeah. So I will just play the video.
Yeah. Okay. Thank you.
Thank you.
Plastic pollution due to COVID-19 pandemic review. As for introduction, during the COVID-19 outbreak, which hit countries worldwide, making most of the countries in lockdown, the situation deteriorated the social, economics, and health system in all countries involved. Aside from that, the lockdown rules force people to stay at home and change their norms. People are also obliged to use personal protection equipment, such as face masks for self-protection from the virus to avoid infection. The lifestyle of 24 hours at home has further changed consumer practice to use single-use plastic for food deliveries or shopping packaging. And this new lifestyle increased the plastic demand as plastic protection, thus resulting in the rise of plastic waste, where the consequence of the rise is still remain unknown since there is still pandemic here today. For the methodology, the initial step to present the issues of microplastic due to COVID-19 pandemic was analyzing the related paper and connect any identified relationship between microplastic and COVID-19 pandemic. Keywords such as search engine including Google Scholar and Google were utilized by limiting years from 2019 to 2021, and keywords such as microplastic, plastic, COVID-19, pandemic, face masks, and single-use plastic were used in this process, which resulting in the identification of 571 articles. However, only 121 articles remain after the screening process, including news article, organizational report, which total of 70% articles related to microplastic pollution was analyzed. For the surge of plastic during COVID-19, as a result in the current pandemic, the demand of plastic products, notably in medical and packaging supplies, has skyrocketed and increased the plastic waste. This attribute to increase in consumer demand due to the extensive utilization of online purchasing and food delivery service, as well as the cleanliness in the other self-dependent. Here we compare the PPE used in Malaysia and China respectively. The demand for the face mask saw up to 160 million in February 2020 in China, with the population at 1.4 billion people. Meanwhile, in 65 billion demand for medical gloves was requested, with estimates predicting at 12.5% growth in 2020 in the same country. As February 2020, China's daily surgical mask output had climbed to 14.8 million by February 2020. For plastic packaging, there is no data for China. Meanwhile, in Malaysia, like other countries, which has been locked down since March 18 in 2020, has adopted the same new norm. Malaysians also began wearing double surgical face masks as an extra layer of protection in May 20 and 21, which doubling the amount of plastic used. Previously, monthly demands for 89 million, 76 million, and 1.6 million respectively for face mask, glove, and protective goggles also reported in March 2020. As a result, over 200 billion face masks and gloves are estimated to enter our environment in each month. Next, this is the types of plastic polymer used. The PPE is primarily composed of single-use plastic, known as SUP, which have decreased contamination and illness transmission. SUPs are made such as from thermoplastic, such as polyethylene terephthalate, polyethylene, polystyrene, and polypropylene, and thermosets such as polyurethane or urea formaldehyde resin. Plastic resin also used in SUP goods, which produce 26% in Northeast Asian countries. An example for this, polypropylene, which is comparable surfactant to the most popular raw material used to create N95 mask as surgical mask, where additionally the surgical N95 face mask weigh 3.5 to 4.5 gram and 9.0 gram to 18.14 gram respectively, which used in the face mask production. While for plastic packaging, usually they use polyethylene, whether HDPE or LDPE. In here, plastic during COVID is act as a protector. Since healthcare workers use PPE alone or in combination, and each PPE has specific use for infection protection. Gloves and gowns, for example, worn as part of normal precaution of contact when handling potential infectious object or contaminated surface. Similar to the face mask and glove, which is as shown here, becoming normal to use in everyday life. During the epidemic, plastic made a significant contribution to the healthcare industry and community health protection. In addition to the nationwide lockdown, social isolation, and travel and public gathering restriction, the regular use of hand sanitizer and wearing PPE also to avoid virus contamination and that further combat the COVID-19 spread. However, plastic also become polluted during the COVID-19 pandemic. Since COVID-19, the contamination through reusable plastic items. Hence, during pandemic, people only use single-use supply because because the virus COVID-19 was to blame, since it could stay on plastic surface for a long time or several days. Thus, if solid garbage is not correctly managed, plastic products such as SUP for PPE or packaging could jeopardize environmental health. Looking at the global scale of single plastic consumption, the water bodies will be more likely to expose to plastic contamination as a result of this plastic pandemic situation. The plastic waste from daily face masks or face shield usage was not well managed and will end up in our ecosystem plastic as plastic and eventually will become microplastic. However, the process of plastic to become microplastic is also takes a lot of time to degrade. In the meantime, the improper plastic waste are also harmful to animals exposed. For example, macaques try to eat face masks left behind the passerby in Genting Sepa, as shown in the slide. Then the gull caught in PPE face mask in Cairnsford, as reported by BBC in 2020. A perch, this is perch that trapped in the discarded glove that was found during kennel cleaning in Netherlands, based on The Guardian in 2020. And next is the incident by the robin wrapped in the face mask in April 2021. However, we predict that microplastic during COVID-19 becoming microplastic. How plastic becoming microplastic? The mechanical character of plastic varies depending on their molecular weight. Thus, the degree of deficiency will radically weaken the material. Once the plastic was littered or becoming waste, it will continue to degradation process and the fragmented of microplastic becoming fragmented of plastic waste becoming microplastic and resulting in ingestion by fish or other organism. As for the conclusion,
sorry, the time is up. Now we will proceed to the Q&A session for 5 minutes.
Okay. Actually, I don't have background in microplastic, but I'm curious something. So my question is about biodegradable plastic. Today, many industry and like business or supermarket offers the use of biodegradable plastic for plastic bag or plastic container. Do you think which one is better between the new one, the new plastic or biodegradable plastic? Because I think biodegradable plastic can provide microplastic as well, right?
Yes, biodegradable plastic, as much as I concern, is only increase the rate of plastic to become microplastic. That's not necessarily decrease the amount of microplastic. The microplastic is still there.
Okay, because plastic still there, but just change the form to small pieces, right?
Yeah, yes.
So is this more harmful?
In terms of microplastic, yes, it is harmful. But in terms of macroplastic, it is not, because it's already become micro.
Okay, thanks.
Okay.
Is there anyone have any question? Dr. Wanzuha, Dr. Nur Hayati.
Right. Okay. Thank you. Very interesting presentation about the plastic. Yeah. All right. What is actually the results out of this analysis? What is actually the determination from this study?
Basically, the study is to highlight the plastic during this pandemic, which is it might increase, and this increment will consequently will increase the microplastic in the future. So in order to decrease the microplastic in the future, we should manage the macroplastic first. Am I answering your question, Doctor?
All right. So those results is actually for the purpose of who gonna use those results?
It's basically we are gonna use this result because according to this analysis, we aware that when we are not manage the face mask or our plastic packaging properly, then it will end up into the landfill, which is will end up in our water body and will end up as a microplastic. So that we need a system that should manage the plastic properly, because during COVID-19, we are not recycling that plastic because we are concerned about the infection of COVID-19. So,
okay, Farhan, thank you. And how far is the development of the system? Do you have or what stage now?
This is only an analyzing state. The next state should someone or some agency should properly propose the management of plastic in Malaysia.
Okay, a review. And how that you get those results just now that you populate into the map? From where? The sources of those?
The sources of this number is currently from study paper, article journal, and some of this from news article. But currently in Malaysia, we do not have specific agencies that provide this data yet.
Okay, very well done. Okay, time's up. Thank you. All the best.
Thank you.
Thank you, Ms. Noor Farhan. Now we will go to the paper titled COVID-19 Risk Assessment based on sore throat condition by using machine learning, presented by Ms. Fatma Muzammil.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Hello everyone, my name is Fatima Muzammil. I'm from University of Technology Malaysia. Today I will present you about my paper, which is COVID-19 risk assessment based on sore throat condition by using conventional image processing. As we know today, the world is creating a third wave of COVID-19. This wave maybe causes more damaging than the second one. So in view of this high transmission rate and rising number of infected patients, screening of these diseases is very important. There are some methods used today, such as PCR test and antigen test, as well as there are some vaccines used today. So even if vaccine achieves 70%, still this screening needed to be conducted, because most probably that the COVID-19 will become endemic, which is mean never ends. As I said in the previous slide, there are some methods used to screen COVID-19, such as PCR test and antigen test, which have proven to provide a good way to screen COVID-19. However, those methods still require time, which cannot be less than 1 minute, and require high cost and special preparation. As well as there are some methods used before to conduct assessment, either use saliva or sound, but still the problem in terms of cost and also speed. So in order to have this, one of the methods that is still challenging is to screen sore throat and differentiate between image of sore throat for COVID-19 and normal subject. So that's gave us to make this assessment based on sore throat condition. So our objectives from this assessment to differentiate the image of a sore throat between a COVID-19 subject and normal subject, as well as to use conventional image processing and deep learning to make free, low cost and fast COVID-19 risk assessment that can be useful in many locations, such as airport and seaport, in order to reduce the risk of COVID-19 after people achieve herd immunity or 70% vaccinated. So in order to achieve our objectives, we follow this method in order to get the final result. Actually, for our projects, we have two methods, which are conventional image processing and deep learning. For conventional image processing, this is we'll use or we already use now for this stage, since we have limitation of the data. We will use deep learning in the second stage after we get all the data from the hospitals, because deep learning need more data in order to training and test the model. So for conventional image processing, actually it's include 4 main stages, which are data collection. For data collection, we collected the data from one subject when she have COVID-19 in day 3, and from day 6 till day 10, and when she was healthy. After that, we did image pre-processing by using ImageD, which is open source software that included powerful libraries for image processing. And then we did image enhancement by using the same software. After that, we extract the data by using histogram analysis, and we use this data to differentiate between image for COVID-19 and normal subject. So for the image pre-processing, the first thing that we did is resize the image and then converted the image into 8-bit, which is grayscale, in order to do some enhancement on the image. After that, we did image enhancement by using smooth process, and then we did normalization in order to improve the image quality. After that, we extract the color information from the image by using histogram analysis in order to differentiate between COVID-19 image and normal image. So as a result of image pre-processing, as you can see here in this figure, this is normal image, and this is the image after we did pre-processing, as well as the second figure, which is illustrated the image enhancement. After we did some pre-processing, we did enhancement on this image in order to prepare it for the next stage, which is extract the data. So as we can see here, this is the result for all COVID-19 images and health image after we did image pre-processing and image enhancement, and then we extract the data by using histogram analysis. As you can see here in this table, which illustrated the data that we took from histogram analysis, from this result, we can say that if the mean is more than 94 and less than 112, this is COVID-19 image. And if it is more than 123, this is a health image. From the result also, we can notice that in day 10, the mean of or the data is almost same or almost close to health image, which is mean that is day 10 almost the patient healed from COVID-19. So that's why the result is very close. So this assessment, what we can see that this assessment is almost work on early stage of COVID-19. In early stage, we can differentiate between the COVID image and health image clearly. As a conclusion, actually we're able to differentiate the image of sore throat between a COVID-19 subject and normal subject, as well as we use conventional image processing only on this stage due to limitation of the data, because as I said, we're waiting to get the data from the hospital in order to apply in conventional neural network model. For conventional image processing, actually it's achieve low accuracy. For that, as a future work, when we will get the data, we will work with the deep learning method in order to make a free low-cost assessment for COVID-19 based on sore throat condition. These are the references. So this is the end of my presentation. Hopefully you get information about my topic. Thank you for your listening. Any questions? Assalamu alaikum. Assalamu alaikum wa rahmatullahi ta'ala.
Thank you, Ms. Fatima, for your paper presentation. Now, I would like to open the Q&A session.
Fatima, good
Yes.
presentation.
Thank you, sir.
I have one question.
Okay.
How you did the classification?
Actually, since now I didn't any classification because for COVID-19, we already asked many doctors how to differentiate between the image of COVID-19. Actually,
Yes.
there is no feature till now. They didn't know because actually this research is with Airlangga University in Indonesia. We we asked the doctor and we show the image, and unfortunately they couldn't differentiate between the COVID-19 image and the normal image. For that, that's why we plan to use deep learning. And just for this stage, we needed to see just if we use conventional image processing, if that will give us differentiate between them. Just it's like that in assuming, just in manual way. We just extract the data and then we can see what or we can from the result we can say that if the COVID-19 have been like that and that. So here there is no any classification for now, but for later after we get all the data, we will use deep learning in order to let the computer to extract the feature of the image.
So where you get the mean value?
I get from the image from one subject have COVID-19. We get it from histogram by using histogram analysis.
Oh, you use the histogram analysis.
Yeah.
But and then you use the software that you written there in Fiji. What that Fiji is the camera or what?
Fiji, it's open source. Use Java.
In Europe, right?
Yeah. Excuse me. Actually, Image Fiji is.
Sorry. Continue. Sorry.
Yeah. Sorry. So actually, Image Fiji is open source software. Use not needed for use coding. It just including all libraries, powerful libraries for image processing. So by it, we can do more things on the image without using coding.
Okay, so which means that at the moment there is no, because you mentioned you got 100 data, right? 100 images.
This 100 images, this is I will get inshallah from the hospital, and maybe I get more because I'm already applied for ethical issues and like that, and this is take more time for now.
So now you got only one image for healthy patient and one image for the COVID-19 patient.
Yeah.
Is it?
Yes. Because actually, it's difficult to get all the data now from the hospital. Actually, this is the data from me until I have COVID-19. That's why, because it's difficult to get image from the hospital now without physical issues.
So, but why you need deep learning since you got the histogram features that you can differentiate by the mean value?
Yeah. So actually, here, as I said to you before, deep learning can give us better accuracy than the conventional image processing. Since the image processing is depend only on the assuming. We just say that yes, COVID-19 have mean from this and that. But for deep learning, actually, if we train the model with the more data, actually the model can get the features of the image by himself. So that can give us better accuracy because, as I say to you, it's from the doctors. They say there is no any feature now in order to say this is, if we see the image, in order to say this is COVID-19 or this normal fraud. That's why we need to use deep learning.
Sorry, my last question.
Okay.
What is your final result?
Final result for now, we just use conventional image processing, and we're able to differentiate between the image of sore throat and normal throat by using just the mean for now. But as a future work, as a future work for better accuracy in order to make all the system or free low cost, we will use deep learning and we will train model with the more data in order to get better accuracy.
Okay, all right. Good, thank you.
Thank you so much.
So thank you, Ms. Fatma, for your presentation. Now we will have a presentation named Social Distance Monitoring Using a Low-Cost 3D Sensor, presented by Mr. Muhammad Amran Hussein.
Hello everyone. Thank you for joining the online presentation today. We're still presenting online. That reminds me of the impact COVID-19 has in our day-to-day life. I'd like to quickly introduce myself. I'm Muhammad Amran Hussein, PhD student at Faculty of Integrated Technologies, University Brunei Darussalam. And I will be presenting my work on social distance monitoring using a low-cost 3D sensor, which could potentially be deployed for automatic social distance monitoring. This presentation is divided into 5 main sections. Firstly, I'll present the brief introduction of the COVID-19 pandemic and its current situations. Secondly, I'll share the challenges of existing methods for social distance monitoring. In the next section, I'll present our approach for social distance monitoring, which is followed by results and analysis. Finally, the presentation will conclude with key findings. COVID-19 was first reported in December 2019 in Wuhan, China. On March 11, 2020, World Health Organization has declared it as a pandemic after it has spread across 114 countries. Since then, many countries have enforced strict border controls and lockdowns. Since January 2021, many countries started rolling out vaccine. As of July 2021, 27% population of the world has received at least a single dose of the vaccine. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. To date, most of the school business remain closed. While a few countries are slowly opening up their domestic business and travels, it's facing increasing challenge with the emergence of new variants. Since the beginning of the pandemic, researchers have suggested various methods, which includes using the face mask, isolation, quarantine, social distancing, and community containment to slow down the spread. According to the United States Center for Disease Control, the number of affected people increases significantly without taking steps to slow down the spread, and healthcare systems face increasing difficulties to provide facilities for everyone. This graph shows the number of affected people over time, where X represents time and Y represents number of people affected at a given time. And the dashed line represents the available healthcare facility. Social distance plays a vital role to slow down the spread. In general, social distance is the practice of maintaining greater than usual physical distance for preventing transmission of an infection by limiting the human physical contact, particularly at public spaces such as shopping centers, parks, school, college, universities, medical centers, airports, as well as workplaces. Researchers propose various methods for social distance monitoring, using frontal or side view video sequences, while a few researchers suggested using the overhead positioning cameras. Typically, deep learning-based methods with clustering and distance-based techniques have been used to identify human and monitor the social distance. However, RGB image-based approaches are sensitive to camera calibration, lighting condition, known ground planes approximation, and pixel-to-depth estimation. In order to apply in real-world situation, an efficient system is required, which is robust and doesn't require calibration for integration. Here is a simple visualization of data captured by a 3D camera and image captured by a 2D camera. In our proposed method, we use the depth images to identify human in the scene, and we extract the 3D skeletal joint position from the depth images. From all the joints, we derive the shoulder center joint and extract the distance between individuals. We perform a binary classification from all the distances that's collected and identify the valuation in the current frame. For this work, we adopted the human detection algorithm by Soton et al. That uses a single depth image to identify human body parts in object detection domain. And using that method, we can easily identify 20 body joints. The algorithm has been widely used by researchers for human activity monitor and gaming purposes. Each individuals were given a unique identifier based on their time of appearance on the sensor's field of view. For every person detected in the frame, the Euclidean distance between the center shoulder joint were extracted, and the extracted distances were compared with a given threshold value, TH, to find out if there were any violation present on that particular frame. And for a period of time, all the violations were calculated and we stored in the memory to determine the total number of violations that occurred in that particular period of time. The method was tested on a challenging dataset that we captured, with varying illumination and complex background, while people were working and conducting a group discussion. Here we enumerate the cases that we have observed. In figure A, 4 individuals were present in the frame and no violations has occurred, while in frame B, the 4 individuals were present and identified as red dots, while 2 violations has occurred and detected by the system. And in case C, 3 individuals were present in the frame and 3 violations were recorded as no one was following the social distance guidelines. The table summarizes the number of frames observed for each category, while the number of distance monitored to evaluate our proposed method. The proposed method achieved overall 98% accuracy on the dataset we recorded. Cases where one person was occluded, the shoulder center joint was wrongly identified, hence the accuracy was lower. And we can see that for walking, the person was occluded and some of the frames were wrongly identified as a violation, while no violation has occurred. And also happened when there is no violation, some of the frames were identified as a violation. We also translate our findings into a confusion matrix that shows that most of the cases, the results are rightly identified. A depth sensor-based approach is proposed for social distance monitoring. A depth image provides an efficient way to minimize the challenges faced by RGB images and improves overall detection accuracy. The proposed method achieved overall 98% on the dataset we recorded. By that, we reached the end of the presentation, and if you have any questions and answers, we'll be answering in the next session. Hello, everyone.
Thank you, Mr. Mohammed Hussein Amran, for your presentation. Now, I would like to open for the Q&A session.
Thank you.
Right. Thank you for the presentation, Mr. Amran. How did you compare about what you claim as the low-cost sensor with other existing alternative, what people use nowadays?
Okay, thank you for your question. So basically for a lot of research that's done for social distance monitoring, majority of them are using RGB, and challenges with RGB is one big challenge is subtracting the humans from complex backgrounds. Even the pictures that I have shown actually, in cases, some of the skeletons were not detected, like where the background as well as the human were identical in colors. And in those cases, those failed because the deep learning based method still, the use actually was not able to identify human in the scene. But in RGB, in using depth image, what we realize is because it's not using typical the RGB structure, instead it's using the infrared based light, so we can easily omit the backgrounds and find the subjects we're interested. So in that way, actually it reduces the complexity and improves our human detection accuracy. Did that answer your question?
How you relate that with what you claim as the low cost?
Low cost in terms of time and processing.
In terms of the time processing to get the results.
Time processing to identifying the human in the scene, and the next step is basically once the human is identified, using the RGB based images, there's no shortcut unless we use another trained model to estimate the distance between two humans. So basically in this way, because we are capturing the 3D data, we have the pixel values as in distance we are comparing. So basically that improves the processing time and also overall detection much higher.
Okay, so you have those comparison data, yeah? Because just now you've mentioned, all right?
Yes.
Where are the most suitable venue that we can adopt or adapt with this measurement using your technique?
So basically, we can use maybe in airports or cafe areas where more people gather, and identification of the violations, or maybe monitoring the social distance is required when it's schools, because we know that some places the lights are not really illuminated enough. So in those places we can see there might be lights, there's a variation of lights, then definitely this will be a suitable device to use.
All right. Is there any alternatives nowadays that people implement this kind of distance measurement? From your study, from your analysis?
This type might be also available, to be implemented, or maybe can be studied further to implement in mobile robots that can actually move around and cover a better area compared to, like for my case, I studied from a fixed position, but instead if we mount it into maybe a mobile robot, and we'll be able to cover a broader area. So it has a potential application on robotics as well.
Mm-hmm. All right, thank you.
All right.
Amran, I just have one question. You use RGB or RGBD?
RGBD. So basically the skeleton,
RGBD.
Skeleton was derived from the RGBD image.
Okay, you just mentioned RGB.
RGBD. So for my case,
yeah,
instead of direct.
In your slide, you should put the RGB. I'm right?
Yeah, yes. Give me a second. Sorry, Tuan. I need to refer to my slide.
No, it's okay. It's okay, because I think from your slide you say RGBD, but in your conclusion you say RGBD. So I'm quite confusing, right? Because if you use RGB only, you cannot do the distance. You cannot calculate the distance between two persons.
No, no, no.
So you use RGBD, right?
Yes, yes. In the conclusion,
okay. I just want to confirm that.
Okay, good one.
Okay, but it's a good basically it's a good research for that, because I think I recently cannot see that kind of system that apply in anywhere.
Thank you.
Good job.
Thank you, sir.
Thank you, Mr. Amran. Now we were going to have a live presentation with the paper titled Software-Based Clinical Alarm Monitor for Monitoring Alarm in ICU and CCU, presented by Ms. Songkla DB. She's going to do it live presentation.
Very good afternoon. Can you all hear me? I'm Songkla Devi Tangavelu. My presentation today is on software-based clinical alarm monitor for monitoring alarm in ICU, CCU. And this was developed by our team, headed by Prof. Eko Supriyanto, Muhammad Haider Abu Yazid, Shaman Kalarasu, and Aisha Kalarasu. To start off with is the introduction of the application of alarm system in medical devices, especially in ICU, CCU. Alarm is triggered if there is any abnormality in the measurements of the physiological condition or therapeutic values, where it senses the upper or lower limit of the monitoring condition. When it exceeds, the alarm is triggered. The present alarm problems in the medical devices, especially in healthcare institution, focusing in ICU, CCU, intensive care unit or critical care units, there are too many alarms and too many false alarms, and the alarms are too loud and annoying. And this has led to many issues or adverse events, likely like poor performance and alarm fatigue. This is among the clinicians working in ICU, CCU. And some at certain conditions, like they even switch off the alarm or ignore the alarm, and there is delayed identification of alarm source and delayed response among the clinicians and inappropriate response. And this is very important to have appropriate alarm response, because in ICU, CCU, the patients are critically ill, and the response, immediate response is very critical, and poor users' response, especially in ICU, CCU, prove fatal to patients. The numerous adverse events reported in not only in Malaysia, in US FDA, in MHRA, and in European Union, and so on. Yeah. So the issue with the present alarm is one part of it is looking into the human factor of the clinicians. Yeah. So this study is focusing into improving the user response to address the cognitive ability of the user. And it starts off with the development of a software-based clinical alarm monitoring system based on human factor. So the objective of this paper, this study, is to develop a software-based clinical alarm monitor, a conceptual model, in short CAM, based on human factor to detect alarm signals of 4 vital signs, such as heart rate, respiratory rate, blood pressure, and oxygen saturation. Yeah. So the methodology that was adopted in this study is to identify the features and functionality of this monitor and identify the alarm information system. So this too was conducted in based on human factor methodologies. It started off with observation study in ICU CCU in one of the public hospitals to gather information on the current scenarios in ICU CCU where they have to respond to the alarm system. And a second study was on the application of task analysis to identify the task that has been performed in the ICU CCU and how well it has been complied with. And this, the outcome of the task analysis was verified and validated by the consultant clinicians in the ICU CCU. And the third mode, which was adopted, was the focus group, because if you are relating and trying to study the human factor among the clinicians comprising of consultants, specialists, medical officers, and most of the time the nurses, yeah. And we had a group, we had to schedule a focus group meeting to discuss on the outcome of the observation study and also on the task analysis. And outcome of this was identified through root cause analysis, RCA, yeah. And outcome of this was verified. What is the root cause of this the alarm problem in ICU CCU, which actually affects the human factor, usually using the usability studies or reference to the IEC 62366. So where it has to be done in the environment of users, and the outcome of this first phase study was compiled as information that's required to be embedded in the alarm system, focusing on the auditory alarm and the visual alarm. So in short, this information was compiled and as a template into the alarm information system. Once this information was gathered, it was developed, the new alarm, or the auditory alarm and the visual alarm was developed based on this information. This information was embedded in the audio and visual alarm. And finally, this system, this new alarm, this new information was developed as a simulation, was done based on the usability study and a pilot study. So the findings of the studies were compiled and identified as features and function into 4 quadrants, where each quadrant carries the information of the 4 vital signs. This basically, this alarm monitor monitors the alarms of the vital sign measurement. As I mentioned, the 4 values, yeah, for physical vital sign measurements, yeah. So the 4 quadrants, one is the auditory alarm, and the second one, the visual alarm. The visual alarm is color coded into blue, which is the normal value of the vital signs. Then the yellow is the medium risk, and the high risk is red in color. And when there is a low risk, when it's slightly above the limit, based on the studies of the focus group, and it was suggested that low risk alarm should not trigger any auditory alarms, yeah. And because one of the main reasons of the alarm problem or alarm fatigue among the clinicians, which affects the human factor and the condition, which is very high risk and too many devices they have to monitor, is too many alarms. So, and based on the literature review that is done. So we try to reduce the alarm, the number of alarms, and at the same time to embed the information in the alarm to assist the clinicians to respond accordingly. So the next slide is on the, after identifying the features and the functionality, the details of the information, the alarm information system. One is on the type of alarm, which means to say when the audio signal will signify whether it is a technical alarm meaning to say the technical fault in the alarm system. And second is on the clinical alarms. And this is all based on IEC 60601-1-8, the alarm requirements that has been stipulated and to be adopted for alarm system in medical devices. So the information, whether it's a clinical or a technical alarm, will be based on the frequency that has been recommended in the standards. Yeah? Second information is a risk-based patient condition. For example, the condition of the patient, like for example, the COVID patient, they have categorized as 4 categories. So in this alarm system, the patient condition will be color-coded, and it's based on the news. Yeah, there's a news system that determines the condition of the patient, and this has also been addressed and recommended and discussed among the focus group. Yeah, this is color-coded. And the third information is on the alarm classification. For example, we have 4 types of vital signs, and each and every vital sign will be classified based on the risk is imposed on the patient. Yeah, and how is it addressed is based on the tones of the alarm, audio tones. So single tones is used on the high risk and medium risk on dual tones. Yeah. And the fourth factor that is embedded in the alarm sound is the alarm condition. The criticality of the alarm condition, it is color-coded. So we have 2 information to address this. Yeah, one is the tones, the alarm sound, and the second one is the visual. And the fifth one is the urgency mapping. This indicates the urgency to response. Yeah, and to summarize it, the development of the new alarm sounds, the second phase will be the 2 alarm system, the technical alarm and the clinical alarm. And the focus was on the clinical alarm, where it is divided into high priority alarm and medium priority alarm, where the medium priority alarms are the NIBP, non-invasive BP, and SpO2. High priority is on the heart rate and respiratory. And the information will be embedded in the audio and the visual accordingly. And this is the template of the clinical alarm monitor. We have color-coded all the information embedded in the first information on the patient, the color codes for the condition. Yeah. And this is my last slide. These are the conclusion and the outcome of the studies. We are based on the usability studies, the frequency for technical alarm, clinical alarm, and the high priority alarm, and also the medium priority alarm. Simulation study on the usability and based on usability, the user were able to identify the risk and the type of the alarm and the technical alarm, clinical alarm, and the technical alarm. That's all. Thank you very much.
Thank you for your presentation. Now I would like to start the Q&A session. Dear Chair, Co-Chair.
Right, thank you for your presentation. What is actually the feedback from those unit who's going to use this different type of alarm? Did you Yeah.
Okay. This alarm is meant to address the issues of the ICU-CCU, and it will be used in the ICU-CCU. As you can know, as everyone knows, the condition right now in COVID-19 patient in ICU-CCU, we need to have something on remote. Yeah, now in the present ICU-CCU, it is all physically monitored where the clinicians will be there. So this will be the ideal condition when we have a software monitoring of the alarm. Physically, the equipment will be attached to the patient, and this monitoring can be done remotely to monitor the critical condition of the patient. So it's meant to be used in the ICU-CCU, and this is addressing the patient monitor.
Right. What is the mechanism that you use? How actually the monitoring is done? And then how to capture which alarm that is actually trigger to the situation?
Okay. Okay, there's four quadrants here. One is the ECG or heart rate, and which captures the heart rate, the saturation, concentration, and everything will be labeled, the NIBP and the respiration. This can be adopted as an app in future. That's what I'm planning, as it can be used for home use also, where it can be a simple app, but it triggers when your patient is in the clinics and you are attending a meeting, and these four quadrants will indicate which alarm has been triggered, yeah, and it can be also to address the requirements of the patient and the color code. Each and every patient will have an ID. So you can have 10 patients, and this app can indicate which patient is in a critical condition and it needs treatment. Yeah.
Right, thank you. And another one is to find out the way to attach or to integrate the system according to the current hospital system. Is there?
Okay, that's a good question. Yeah, because that's what the next planning, and actually I'm undertaking the testing to incorporate these, and I'm using the mimic data that I've obtained to improve on this. Yeah, which means to say this system or the apps can be integrated with patient monitor or any kind of devices to customize it according to the equipment. Right now, I'm doing the improvement on the performance using MATLAB and using the testing with the mimic data to improve the performance of these sensitivity and the specificity of this alarm monitor.
Right, thank you, Doctor. Right. Do we still have time for Q&A?
Yeah, we still have time for the Q&A.
Sorry, not still?
We still have time for the question.
Right. Do you have the feedback from the users about the false positive alarm or false negative alarm? For example, annoying or something like that.
Okay, this is the first part of the alarm where I use human factor to improve the alarm sounds to address the requirements of the clinicians. The second part will be to improve the to reduce the false alarm. That's where I use the MATLAB to accurately classify each and every alarm so that this high sensitivity and to ensure to reduce the false alarm. That's the second part I'm doing. This first part is on human factor so that they are receptive and they can respond accordingly. Second will be the performance of this alarm.
And now it is in laboratory level or industry level so far?
Now in the second phase, completing, already completed and doing the documentation on the improvement of the performance to reduce the false alarm. And completing the documentation where this is verified and validated by a specialist. The data produced by the classification of this alarm monitor has been verified and validated, and now I'm in the documentation to address the sensitivity and the specificity.
Okay. Thank you.
So this is the end of the slot 1. Thank you for everyone. Going to start the slot 2 after 20 minutes, so everyone can have a break and take rest, and then after 20 minutes we will start slot 2. I would like to remind everyone to check the chat box and fill the registration form.
Hello? 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 Assalamualaikum, very good afternoon to everyone. Today actually we'll go for the next session for the presentation this afternoon. Thanks, welcome to everyone, to presenters and all the panels for actually for today's presentation. I'm not sure whether my everyone can hear my voice.
Yes.
Is it yes? Yeah, that's good. Okay, today actually we continue with the what's called the presentation. Actually, we have around 5 presenters, and welcome to the panels, which is the Dr. Chila Varakupipia and the Associate Professor Dr. Zul Helmi Ismail, and all the panels and presenters. Okay, all right. Maybe I think just I want to share with all the presenters. Everyone actually is allocate around 10 minutes to present, and 5 minutes for the question and answers. We will start with Safa Osman Abu Zaid Osman, and she have 2 papers to present. Same thing goes to the Hassan Harith Al Razi. You also have 2 papers, and another one is from the Abba. All right. Okay. I think is it the presenters is ready now?
Yes.
Is it the presenters ready now?
Yes, here is the presenter.
Okay, timekeeper, are you ready now? Panels, ready? Without delay, okay, now which is we'll start all this session because now it's already 4 o'clock. Hope that we can start now. 10 minutes for the first presenter, which is the Safa Osman Abu Aziz Osman. The paper title is a person identification based on low quality mask face image using what is one? Using machine learning. Yeah. Okay. Safa, now you can start. Floor is yours. Thank you.
Assalamu alaikum and very good day for everyone. This is Safa Osman from University of Technology Malaysia. I want to present my paper with the title of Person Identification based on low quality masked face images by using machine learning techniques. So first of all, I want to start with a brief introduction. Face image recognition has become a core research area for the pattern recognition sector in recent decades. And in current era of COVID-19 pandemic, any country's government considers public health to be the most important priority among their other sectors. And this lead to implemented the SOPs in companies, schools, offices, and markets, which include wearing a medical mask. So face recognition system, which have been perhaps the most essential means of contactless identification, must be reformed in light of these circumstances. It is important to mention that in real-world video surveillance and robotic applications, observed faces typically exhibit low resolution. So this leads us to introduce our project or the objectives of this work, which start by improve the brightness, resolution, sharpness, and blurring of input low quality masked face images, and then recognize these image and visualize person identification by using machine learning techniques. In order to achieve these goals, the methodology of proposed model will be consist of 2 main parts. The first one is for training the model, and the second one is the masked face image enhancement and recognition. As we see here in this block diagram, here is the first part, and then the upper one is the second part. The first part starts by collecting database of masked face, and then extract features from these data, and then learning or modeling the features by using a classification algorithm and build a classifier. And then in order to evaluate this classifier, we will insert an input image, which considered to be a low quality image. This image will enhancement first and then extract the features from it. This feature vector will be entered to the classifier, and the classifier will compare the feature vector of the enhanced image with the feature from the dataset. Then the output will be the person identification. For the dataset that we used small dataset of 7 people, each person receiving 20 images. Then the total of 140 images is taken for processing. Here's some examples of these data. For the feature extraction, we will use the algorithm of ResNet 18, which is a convolution neural network. It's a pre-trained algorithm. It consists of 18 layers. Here is the analysis of the algorithm. After we extracted the features from the dataset, it will be saved as a vectors in the database, another database. Each one with the corresponding label, and we use SVM for this training. Okay, for recognition, we will start, as I mentioned before, by image enhancement because the input image is a low quality image. The enhancement technique has different steps. It started by enhancement the brightness, and then adjust the contrast of the image, sharpen the image, enhance the resolution, and finally crop region of interest. The region of interest, or the image that cropping, will undergo for feature extraction and classification then. The first step is to enhance the brightness. We use MIRNet, which is a deep learning approach provided by Zamir et al. I got from previous literature. It is used for improving low light photos. As we see here in this example, I used the algorithm or the model to improve this low light photo to this satisfactory light photo. After that, this is another example for using the MIRNet. As we see here in this, this is the output of MIRNet. As we see, it's a very low contrast image. Then I entered this image for contrast correction algorithms, and I get the result. After that, the result from this step will go for the enhancement of the resolution by using the super resolution using a generative adversarial network or SERGAN model. This is also a deep learning method got from previous literature. As we see here in this example, the output is a good resolution, but it suffered from blurring. So that this image will undergo for deep blurring and also for sharpened. And here is the output. The last phase or the last step is to crop the region of interest. Face identification with HAR cascades is a machine learning strategy that involves training a cascade function with a collection of input data. So it is a function in the OpenCV that's used to detect faces. As we see here, it can detect face, and then it can we can crop the region, and this is the result. The result will go for feature extraction, and it gives us a vector of features. This vector enter to the model or to the classifier to get the corresponding label. As we see here for the classification, we adopted SVM, support vector machine algorithm, to classify between the test feature vectors from the enhanced image with the feature vectors in the database. Here's some of results of support vector machine. Some of labels is wrong. To test it, we use the confusion matrix, as we see here in this confusion matrix of the support vector machine. As we noticed that some of the labels are got 100% recognition, correctly recognition, like for example here in Ahmed, Brad, and Hind, Will, all of them are get 100% recognition. So the accuracy of this model can be calculated from the confusion matrix, and it will be equal for 85.71%. To discuss this result, first, the MIRNet method that used to enhance the low light image, the results from it is satisfying in the term of enhancing the light, but it is suffering from low resolution, low contrast, and noise. That's why we enter the results of this model to another phases of enhancement. Also, the image result from super resolution phase, which is Sirjam model, also suffering from blurring, as I mentioned before, and also it needs to sharpen before we go to next processes. If we improved enhancement methods, it will improve accuracy as well by ensuring that the test image is of the same quality or level as the original photos in the dataset. So in the conclusion, when compared to other mask face recognition algorithms, this is the only one that considers the reality that not all photographs are of great quality. There is a previous work that working with mask face, but all of them was considered the input image with good quality. Okay, for future work, the system will need to add more data because, as we mentioned before, I used a very small data set. So we will need to add more data for training and testing, as well as incorporate other enhancement approach. A mask facial recognition system that can enhance and anticipate a person identification in real time and with a short processing time can be developed. This is a not real time model. Okay, that's all from me, and thank you for listening, and be free to ask questions if you want. Thank you.
Thank you very much. Thank you so much, Safa. Very interesting, richest presentation. Okay, now it is Q&A. Maybe panels, Prof. Zul and also Prof. Hayati. Anything you want to know? You can ask now. Any question, Prof. Hayati and Prof. Zul?
Right.
Panel?
Thank you, Prof.
Okay, carry on.
Thank you for the presentation, Ms. Safa, just now. So far, how many data that you have with you as the pattern, yeah, that you studied, and in terms of the effectiveness, how is the percentage of that in terms of it is actually accurate?
You mean the percentage of training data and test data?
Yeah, the accuracy of the results.
Okay, for the data I used as mentioned before, 140. This is the total, and 80% for them for training and 20% for them for testing. So it's not a very huge database, it's a small database. Am I answer your question?
Right, in terms of the accuracy of the results, you mentioned about low quality images, yeah? How you determine that? What is the definition for that, please?
Okay, the system is considered all input images is low quality. So for testing images, I used low quality images, but for training the model, I used satisfying quality, good quality for building database. But for the database for the testing, it was low quality in terms of blurring, light, and so on.
Okay, and that definition, that measurement, you have following standard for that? Your determination medium or high quality image?
It's not a very high quality. I just use.
My question is, following certain standard to determine it is low quality image? Are you based on any standard for that?
No standards. You mean from something like?
Yeah, because how you determine for the definition of low quality images? What do you mean by that?
Actually,
yeah.
The image before pre-processing cannot, for example, for cascade or hard cascade, detect for the face. The algorithm cannot detect the face before doing the pre-processing.
Right, and that one is based on static image, 2D photograph, or what?
No, actually, I didn't do any static.
How you capture that image? Is it online from the camera or how?
Yes, I reduce the resolution and take the photos in low light. And with low resolution camera, I mean, I didn't use, for example, for the phone cameras, I reduce the settings in low quality, and also I use Photoshop for deformations images.
Right. I still would like to understand your approach, your technique. Just now, the images is not the real-time images being captured.
Yes.
How you do? Like people need to stand in front of the camera. It is part of the image recognition, right? To identify the identity of the person behind the mask. Yeah.
Mm-hmm.
So, what
this is
where to implement this? They have to stand still in front of the camera, then only being captured, or how? What is the accuracy for this technique?
Okay, the main idea is to using the images capturing from surveillance cameras, for example. So the images from them are low resolution because the distance is because the distance is very large, so the image will be very low resolution, as well as sometimes for the environment circumstances, sometimes the image can be in low light, for example, or in blurring. That's why the what we call the image must be.
Thank you. Time's up.
Okay, thank you, Safa. Maybe my suggestion, Safa. When I read your what's it called your research on this is only my suggestion. I think you really need to be very careful in terms of getting really understand of the data noise and data integrity. Yeah, the object integrity. I think better you go to read the Peng ETL 2019. It's a very good solution. When you go for the crop image, I don't think so that your crop image is good techniques there. I think you go to read more journals on the researcher is Peng ETL 2019. It's good paper for the crop image. Yeah. Okay. Thank you, Safa. Good. I think very interesting. Then we can go to the next presenters. Is the same person, Safa Osman Abu Zaid Osman. The next paper is patient. Sorry. The next paper is the patient management system in the emergency department during COVID-19 pandemics using technology IR 4.0. Are you ready, Safa? Right. Okay, we can start now.
everyone. This is Safa Osman from University of Technology Malaysia, and I'm going to present my paper with the title of Patient Management System in the Emergency Department during COVID-19 pandemic by using technology IR 4.0. So first of all, I want to start with a brief introduction. Basically, middle and low income countries are suffering from inadequate resources and inadequate lack of staff support. And also there is a large number of patients who are visiting emergency departments daily. These limited resources leads to overcrowding, and patients may waiting for a long time, and they may get a long triage and diagnosis. And also it leads for low accuracy of treatment and eventually for high mortality. The common patient conditions that coming to emergency departments are car accidents, acute abdominal pain, and bone fracture. For acute abdominal pain, previous data shows that a large number of AAP diagnosis is missed because of limited resources. And also we have another problem of current COVID-19 pandemic. The emergency departments around the world are planning to reduce the spread of the infection while maintaining a reasonable patient flow. For these reasons, we proposed a new model of patients management that focuses on patients with acute abdominal pain in the low and middle income countries. This model will improve patients' flow by predicting the disease path and steps in the emergency department, as well as predicting the risk score of the conditions. And it will lead to seamless information transfer between emergency department staff, which can increase the accuracy of the diagnosis. In order to achieve this goal, the proposed model is designed according to 5 aspects, which are registration and triage, COVID-19 assessment, medical data entry, prediction, disease steps and risk calculation, and safety and security. For the registration and triage, as we know, registration is the initial step in the emergency department, which is a critical process because patients must have a precise identification to ensure that all the data collected is linked to the relevant person. So that the model is based on patients receiving a QR code or in the term of bracelet or tag when they arrive to emergency department. And also the model includes measures of vital signs, which is crucial for the triage process. And this will be done by using a wearable smart sensor. The second aspect is the COVID-19 assessment. According to WHO, each patient entered to the hospital or the emergency department must be undergo for COVID-19 assessment in order to segregate between most likely patients with COVID-19 and non-COVID-19 patients. And the algorithm to decide which patient need to quarantine and which patients not were given from the CDC. The third aspect is the medical data entry. Basically, there are different types of data that needed for complete the process of diagnosis and treatment. The first one is the patient's general information and medical history, and it can be taken from by emergency department practitioner or patient's family through user-friendly interface. And also vital signs can be entered through smart sensors or any Internet of Things technologies. And also the lab results and medical images results can be sending immediately to the computed cloud by taking the advantage of QR code. The fourth aspect is the prediction, disease steps, and risk calculation. So mainly, any abdominal pain condition can be caused by a combination of variables. These variables can be called as risk factors. Like for example, here are some examples of GI constipation risk factor and also appendicitis risk factors. So these risk factors can be linked together to indicate and predict the disease prevalence. So the method here will be based on gathering this data from previous patients And then this data will enter to unsupervised machine learning algorithm, which will calculate the weightage for each factors. And then to evaluate the model or to the algorithm, after entering patient's data, the system will calculate the risk score of each disease. And based on the missing data for the most likely disease, the system will also anticipate the necessary examinations that must be to do. The fifth aspect is the safety and security. So the system will be built to interact with the HL7 interface, and also with the security services that provided from cloud providers, and also under HIPAA Act. Okay, in order to evaluate the model and figure out if it can be useful or not, we asked 22 doctors about their perceptions, and here's the summarize of their results. So 19 out of 22 of them believe that abdominal diseases are the most difficult diseases in diagnosing. And 21 out of them believe that QR code technology will improve the patient identification accuracy and eliminate errors. And 20 out of 22 believes in the accuracy of smart sensor for measuring vital signs, but 7 of them think that employing these technologies may be inconvenient for patients. Also, 6 out of them are not want to rely on the clinical assessment that completed by the nurse, but rather than they believe that doctors should re-examine patients. 21 out of 22 believe that the adoption of such a system can help and facilitate the process of diagnosis, but also they agreed that any decision should be taken based on the approval of doctor. Half of the participants do not have complete faith in artificial intelligence algorithm for disease diagnosis and prediction, but on the other hand, 100% of them believe that this approach will save time and effort. But 3 of them are concerned that if we use these systems, the mere rule of the doctor may be abolished in the future. 100% of the participants believe that implementing such a system can help to reduce COVID-19 spread. And 19 out of them believe that the system is able to suggest appropriate medical imaging method. But on the other hand, 5 out of them will not really sure if this system can be work accurately for managing large number of patients. So in general, most of the participants had a positive perception about using the model, and this because the participant doctors believe that possible errors in the diagnosis of abdominal diseases are usually due to different reasons. For example, the diagnosis is often done by doctors with little experience, so they may need such a system to helping them. Also, some examination and medical lab technologies are frequently expensive or unavailable in LMICs. Additionally, sometimes patients take inappropriate medicines before consulting or seeing doctors. On the other hand, half of the respondents do not agree with using artificial intelligence technologies in diagnosis and predicting treatment steps, and they believe it is untrustworthy. And from my point of view, this is because that a large number of people are not know actually how artificial intelligence is working, and also they not have a clear idea about the high accuracy it can be given. So from the results of the survey, we can summarize some of the pros of the system. So firstly, by managing patients electronically, it can contribute to reduction in the development of epidemic diseases like COVID-19. Also, hospitals can save money on administrative and labor expenditure by using this technology. Additionally, employing a cloud computer server can become the ability to monitor, store, and access patients' EHRs at any location in the hospital more successful. On the other hand, there are some cons, like for example, using these technologies results in annual cost rises, which forces people to pay more for using these technologies. Also, because healthcare is one of the most targeted businesses in the world with far more cyber threats than other sectors. In conclusion, in order to address the issues that arise in most LMIC's emergency department, patient management model is proposed. This system will use various AI algorithms, IoT, smart sensor, cloud computing to provide high accuracy disease prediction, eliminate unnecessary imaging examination to diagnose AAP, and promote patient and staff satisfaction. Also, the model allows for seamless information exchange while avoiding direct communication amongst ED staff, which can reduce the spread of the COVID-19. This is all from me, and thank you.
Okay, thank you. Okay, thank you, Safa. Now it's open for Q&A. Is there any questions? Prof. Hayati or any?
All right, thank you, Safa. Very well done, the second presentation, yeah? Okay, can you make more clearer in terms of the approach that you are taking? Just now, I understood that the system should help in the emergency, okay, do analysis on the condition, yeah, for the patient being sent to the emergency section. Okay, can you explain how is going to happen to do the analysis and to assist the doctors in this emergency with your technology? Are you attached to any particular system in the emergency room, or how? It being done like automate some processes, or how?
Okay, by interviewing with the doctor in emergency department in low-income country, there is no software, but they explain the steps that done for managing people. For example, when they arrived, the triage process, how data is exchanged between doctors and nurses and the lab and from lab and something like that. For most low-income countries, there is no software that doing that. So we propose this software using something like user interfaces, friendly user interfaces for doctors, and another one used for nurses and for lab as well.
All right. Can you show a bit on the system just now? Try to trigger those questions. Did you actually consult with the medical doctor that handled the emergency? Those that you put into your system just now? At the early slides, do you have those parameters, yeah? All the data that you're going to train in the system just now?
Yet, not yet. It's just in the phase of doing something like the phase before actually the mock-up. Right. We just designed the model and the idea and just ask doctor if it will be useful for them or not. But for example, what we call the diagnosis part, if you mention that, from literature, from different literature, this method was give good accuracy and good results for diagnosing. So that's why we want to adopt it.
All right. Is there any specific case of emergency that is more accurate or more useful to be adapt with the system? Any specific emergency case for this type of system using AI that you are targeting using IR 4.0 that you have mentioned just now?
What do you mean by specific case? Sorry.
In your emergency, because are you targeting all emergency cases that the doctors who handle the emergency can use your system, or it depends on a particular section of emergency that best can use your system?
For now, just the cases that come with acute abdominal pain. The cases that related to acute abdominal pain.
Okay, just now you've mentioned about the different types of countries, yeah? So far, as the alternatives to those who already implemented this type of software, is it a very positive results, very effective approach to assist those in emergency?
I'm not really sure if there is a software that already implemented. For my analysis, there is not for low and middle income countries, but may in high income countries there is yes. But for now, as my knowledge, no, there is no alternative.
Right. Okay. Do we still have time, Prof, for Q&A?
Yeah.
Okay.
Yes, why not? Carry on. Is there any? Oh, time's up now. Wow, it's very. It's time up. Thank you very much, Safa. It's good, good research. Okay, carry on. Hope that all the research can be done successfully. All right, good. I think for the third presenters, okay. Actually, we need to. All the research is very interesting, isn't it? Maybe there are so many want to ask, but we have no time. Okay, now the third is actually we'll go for the third presenter is Hassan Haitham Al-Razi. Yeah. The title is Person Identification Based on Low Quality Eyes Images Using Artificial Intelligence.
Yes.
Is he Hassan is there?
Yeah, I'm here.
Are you ready? Okay, now you can start.
I'm ready. Yes.
Okay, you can start, Hassan.
Assalamualaikum warahmatullahi wabarakatuh, everyone. I am Hassan Haitham Al-Razi, School of Biomedical Engineering and Health Science, Faculty of Engineering, University Technology, Malaysia. Today I'm going to present my paper, which is the person identification based on bad quality eye image using machine learning. Firstly, the abstract, we conclude the abstract and the project as a low quality of eye image can be resulted by low resolution camera in the cell phone or moving eyes. We propose a method to identify person in the hospital based on low quality image. System employs an image segmentation algorithm and compares 3 different machine learning approach for effectively classifying each segmented region as the appropriate recognition types. Findings suggest that based on eye image of the classes collected in the dataset can be autonomously recognized people. So the introduction, firstly, the eye recognition is evaluated for automated person identification as one of the most reliable methods. Researchers proposed that the radius of eye should be at least 80 to 130 pixels if we want to get satisfied accuracy of identification. In addition, the weight sharing lowers network complexity, allowing us to do face recognition using less resources. Also, in addition, the quality of pictures or image may be reduced by internal variables such as eyelash and eyelids and exterior ones such as eyeglasses. Finally, the eye detection accuracy is approximately 99.0% on the detected faces. Okay, now next slide is the method and material. Firstly, the eye detection error on eye recognition. The eye location of the earthly reality are intentionally distributed by random noise to see how the identification performance changes according to eye localization in accuracy. Second point is the segmentation that we used in this project. So the segmentation is a major constraint of current work in human eye image segmentation is the application. At the cost of eye tracking research, to the either just task of image classification or single class segmentation instead of multiple classes. CNN become the focus of the segmentation efforts. So as shown here in the slides, this is the CNN architecture in eye image processing that we have used. There is 3 stages. Firstly, as input, we have the image itself based on the data set. Then it's coming to 3 stages. After that, it's become the fully connected layer. And at the end, the output layer and segmentation classes will be shown. Then after that, the eye detection. The eye may be detected for 2 reasons. Firstly, the presence of the eyes is detected, and the second one, the position of the eye correctly. In the most cases, the pupil center measure the eye location. Current techniques for eye detection may be broken down into 2 categories, which is active eye sensing and passive eye sensing. Then after that, eye localization. The technique of our eye location follow an eye geometric restrictions that is used to locate the eyes. As shown here in the slides, the photo, this one, we get it from the Python that we have worked in. So with the code, with specific code, so we could recognize the eye and the name of the specific eye based on the data set that we have included in the code. After that, the eye detection accuracy. So we are able to detect the eye method to all image in the data set or the database. The frontal eye detection rate is approximately 95%. This one for the frontal eye. But for the eye detection alone, it's achieved a detection rate about 99% on the detected face. As a result, we have an overall 99 eye detection rate. So as a result of discussion, prior processing in the image in the database, which are at high quality of 900 pixel wide by 1,600 pixel tall, would likely take a lot of time. In most photos or image, the limbs occupy less than 30% of the area, which means that the features may be extracted from the full image without needing to first get a fracture from the limbs. To provide a greater opportunity to zoom in on the eye areas as being developed based on the extensible markup language, XML. Using a lab map to determine the width, height, and the Y and X minimum and maximum. So we don't downsize the eye picture to like resize it to 480 multiply 640 pixel using modified version of Python code to focus on iris area as shown in the next slide. So in this slide, you can see our result. So we put 4 examples. So they are real eyes. So firstly, we detect the eye itself and shown the name of the eye identification. After that, we crop the image detected. So we crop the eye so we can see the eye itself. Then we have that normalization in 3 stages, stage 1 and stage 2 and stage 3, as shown here in the slides. Then we have that the CNN topography for our proposed neural network that are composed of 5 layers of encoding and 4 levels of decoding as shown below. So you see here the 5 layers. Firstly, the input. After that, the CNN convocation, then the RELU layers, then the pooling, then the full connected, and as output we get the eye ready for identification. So at the end, this is the conclusion. We have created a unified method to eye segmentation, eye recognition, and eye condition analysis in order to improve our knowledge of eye identification. So our system can automatically segment and identify the visual picture or image in a complete form utilizing our purpose CNN model. So the advantage of eye infection recognition and eye progressing are equally relevant to the well-trained CNN, yes, which is the convolutional neural network. Although the system can analyze the image of an eye in an excellent laptop or computer or a good quality hand phone condition with 10 to 20 seconds. So the timing is depend about the device itself. How is it like it's in good condition, so it's gonna do it fastly. So it may be beneficially to use quicker hardware on another machine. So it's as I told you before, it's depend about the hardware that we are gonna use and the machine itself. Finally, we could demonstrate the strength of our system by showing that all status tasks can be achieved. And here the reference. And so thank you. And this question and answer, please don't hesitate to ask me. Thank you very much.
Thank you, Hassan. Very good, interesting. Now it's open for the Q&A.
Thank you.
All right, thank you, Hassan. Now it's open for the Q&A. Is there any? Okay, Prof. Hayati.
Thank you, Hassan. All right. What is the purpose of this eye recognition?
The purpose is to take the image or to identify the patient or the staff in the hospital with low quality image. So maybe when he maybe the staff running or walking fastly. So with this method, we can recognize them with the bad quality of the image that we take.
Right, because just now you did not mention the purpose, yeah? Why you are doing this eye recognition, why it is based on eyes, to recognize of what? Is it the people or the behavior of people? Yeah, please.
It's the purpose is for the in hospitals. So it's for the patient and the staff. So because like if the previous in the hospital, we can make the recognition, but with high quality image. So must take the high quality image. If it's not high quality image, we cannot detect who's this patient or who is this staff. So by this method, we are gonna identify the patient or the staff with low quality image. So we can just take even like if we have like maybe as I told you, like he ran or he walk fastly. So by this method, the camera just will take the photo of him. So by we can detect him with the low quality image that we have got. This is the purpose.
Right. If for the purpose of to recognize a person, yeah, with the eye recognition, what can just implement those available algorithm?
Excuse me again, I haven't heard you.
Okay, if it is for the purpose of the person recognition based on their eyes, what is the difference between the existing algorithm? Why we can't just use already exist solution?
Okay. For this point, as I told you before, the existing in the hospitals, we can detect the patient with high quality image only. If it is low quality, we cannot detect the patient or the staff inside the hospital. But with this method that we have and this algorithm that we develop and by using the Python coding, so we can identify the patient and the staff inside the hospital by the low quality image. This is the main point.
How you're going to implement this at the hospital? Where you're going to put the system to everyone? Where? How?
Actually, we are after like we still develop it, so we want to apply it in hospital here in Malaysia, but because of COVID-19 now we cannot go and like apply it, but in future we are gonna apply it so we can make the system in the control room of the center room of the hospital. So from the center room, like the manager or something, not the manager, like the center room, they can detect any people like rushing or something. And this one, it's also become in the security part as well. So maybe if someone like criminal or something, he just ran away from hospital or he inside, we can detect him so easily by detect him eyes with this method.
All right, because what you verbally mentioned just now, it is too wide, yeah, for you to discover, for you to explore. You must have a very solid objective. What is actually the purpose of this eye recognition, yeah? So if you lump sum just now to detect the criminal based on their identity just with the eyes, because, you know, I'm not sure how you're going to do that. And at the hospital, we know hospital is a very busy places. Usually in the world, at the airport, they use that eye recognition, yeah, to recognize people entering at the main door at the airport, and it is not widely implemented, yeah. And how this approach actually contribute to this pandemic COVID-19?
For this technique, it's gonna approach this book of COVID-19 because we have think once like the cases is high, a lot of like patient come, so they are in rushing and you know the emergency. So we no need for like just take like them identify or something. We just can detect them by this method, so it will be easily, and we like easily to identify them and put them in the system. So no need for like how to say like came to the information reception and put them identification or something, because you know, as you know, this pandemic, we need to have social distance. So I think this one is gonna will be helpful and useful for this kind of situations. And we still we have plans to develop this system as well to cover maybe outside the hospital. As like for me, I'm a biomedical engineer. I just make it in hospitals. Maybe in the future we can like share it to the airports, to the ministries, to the government places or something like that.
Right, thank you. All the best.
Welcome, thank you, Prof.
Okay, thank you, Hassan. Now his time is out now. But very, very interesting research. But my suggestion, my advice, Hassan, I think you need to be very careful. Of course, the CNN is good compared to others method, but you need to be very careful in terms of your the data about the large of the data, and about the positioning, about the orientation of the data is very careful, because actually mostly the CNN is lacking in terms of these three area. All right.
Okay, sure, bro.
You need to you need to investigate more on this particular of the issues. Yeah. All right.
Yeah,
Good.
sure, bro.
Very good, Hassan. Okay, the next presenter, my friend, who's the?
It's me as well.
And again, Hassan. MashaAllah, Hassan.
Yeah.
Now the next paper is from you also. Wow, he's very good. You're very active. It's very good. Very good. Yeah.
Thank you, bro.
Okay, the next paper is about the multimodal person location visualization system in hospital. All right, Hassan. Now time is yours. Carry on.
Thank you. So I should explain or wait? Okay.
Assalamualaikum warahmatullahi wabarakatuh. Today I'm gonna present my paper, which is the multimodal personal location visualizing system in hospital. I am Hassan Haytham Al-Radi from School of Biomedical Engineering and Health Science, Faculty of Engineering, University Technology, Malaysia. Firstly, the abstract, which included in during COVID-19 pandemic, people in the hospital need to be monitored and to ensure that the number of people inside the premises of the hospital is not more than the standard number. Low cost and wearable system are proposed to comply the requirement. We use the quick response QR code and global system for mobile GSM signal as input to detect the patient
staff location. The system is potential to be implemented as a location visualizing system to help the patient and staff during the outbreak. So the introduction. Firstly, the patient tracking system is a total security and hospital management solution. It is the technology used to determine the location of patients using different methods like GSM and QR code. Mobile communication with global system mobile GSM and decoding, which is the process of retrieving latitude and longitude of a location, can be a solution for satisfying the patient need. The location-based mobile healthcare architecture and application help both physicians and management to know the location of the patient that are registered with the QR code. With the application, the registered patient, the management can see the location of the patient or staff. An important fact of this application is to allow the manager to reach the patient at any time, anywhere inside the hospital or the offices. So the problem and the contribution. So the patient tracking system is a total security and hospital management solution. It is the technology used to determine the location of patient using different methods like GSM and QR code model. Patient tracking system use GSM technology to monitor and locate the patient anywhere on the hospital or offices. In this project, we are going to design an application using QR code and GSM with Python software to locate and visualize the patient inside the hospital or the offices by scanning the QR code in the entrance of the hospital or the door of the offices. After that, the GSM will locate the patient in the mobile application anywhere. He goes inside the application, maintain the integrity of the specification. So now the method and the materials. Firstly, we have the development of the application. A technique has been utilized to create solutions that primarily concentrate on delivering high quality functioning websites for patient management. It's tend to enhance company value while decreasing project overhead. It embraces any new needs in its evaluation to achieve a maximum competitive advantage through the COVID-19 pandemic. So the figure below describes the stages of the method cycle development. You can see it here. Firstly, we do the test and review, planning, design, and then develop. Next, so next is the location visualizing system. The location visualizing system is an integrated framework with various layers of software component. It's mainly consists of three main points. Firstly, number one is the low-level operation system layer, then middle-level business and data management layer, and high-level location visualizing layer. One of the most significant components of the purpose approach is the presentation of the location of sensors to the end user in the environment. So now is the application analysis that we have did. So here, this is the concept function of the application process as shown in the slide. So firstly, we do registration, then check the completion. Then we have three main function, which is scan the QR code, then send alert and a message to the management. After that, we deduct the patient location, then send the patient to the selected room in the hospital or in the offices. Then the manager can access to the map of the 3D design and see where is the location of the patient or staff. After that, we have the to design of the hospital room map. So we have designed two maps which are 2D as shown in the figures below. So we develop a hospital room map to relate the result from the map, QR code and GSM sensors. You can see it here, we have simulated hospital room 1 and simulated hospital room 2. We use it like to include it in the application. Next, so this is a flow chart of our project. So firstly, we start. After that, the patient or staff arrive, then check in and log in the application. After that, we scan the QR code. If it's working, it's gonna go to the patient staff identification successfully. If not, he have to scan again until he access successfully. After that, the patient staff location shown by the mapping to the manager, then send an alert to the manager that the patient or staff is already inside the hospital. After that, they assign the patient staff to the specific room, then the end. Next, so the mock data of the application process. The mock data of our application consists of three main parameters, which are patient identification, monitoring, and safety between the user and the admin. So the application unit makes use the acquired location descriptors in application that provide the relevant location information to the intent recipients. The application provide the real-time monitoring capability anytime and anywhere inside the hospital for the intent recipients. After that, the algorithm that we have used an algorithm. So this algorithm explains the connectivity between the HTTP server client and app server. This connection takes place in step-by-step process. So we have 4 steps. First step is user must enter his or her username and password. Step 2, once the details are entered, user must hit the login button. Step 3, the user details will be checked from the server sides. Step 4, once the detail calls through, the intent will pass from the activity to another. So now for the result and discussion. So the results have shown that the application successfully meets all the users' requirements. So the patient were successfully applied to register and log into the application. The risk of COVID-19 were also taken into consideration of referring the patient to outpatient clinics in case of high risk of contracting COVID-19. With the passage of time, technology advances and develops in medical practice and healthcare for patient localization system because of their great troubles. This application has been designed to reduce the high incidence of patients. The application has been designed to reduce the high incidence of patients, so the use of this technology has contributed toward the enhancement of cooperation and collaboration level between the patient and hospital administration. Multiple Android and iOS apps were analyzed, and the finding relieved that the adoption of mobile application in healthcare produce a high level of patient engagement. So in this slide, I'm showing the application that we have designed. Firstly, we have like these figures. Firstly, like the first page, the introduction page. After in this page, he have to log in. After he press the login button, it's opened this page, which have to like put the username and password. And if he's not registered before, he have to like register before from the bottom itself, this login. After that, it's gonna show the this image, which is this page, which is the QR code scanning. So he have to scan the QR code here. After that, once he scanned the QR code, directly it's gonna open the 2D map of the hospital. The next, the conclusion. So in conclusion, we develop a software to detect the QR code and to read the signal of the GSM. Secondly, we develop a hospital map to relate the result from the map, QR code and GSM. We use Python to develop this application, and the system will be connected to the smart hospital software, so it can be used for the patient and staff visualization in 2D view. The result of system evaluation showed that the system is effective and applicable to used in hospital to detect patient and staff location with very low cost situation.
Okay, finish. All right. Let's see. 10 minutes. Sorry. Okay, now let's go for the Q&As. Any questions? Before I pass to the Prof. Hayati. Any questions from the audience? No? You can ask, you can just type in chat there if you have any questions. Okay, now go to Prof. Hayati.
Right, thank you, Prof. Okay, interesting. Well done, Hassan, for your second.
Thank you, Prof.
Okay. The detection of the localization, yeah, the detection of the location for the people in the hospital, okay,
Yeah.
including the staff, including the patient, okay, exactly why is this important?
Okay.
Yeah.
Okay, for this project is we have used QR code plus GSM. Okay, they haven't used it before. They use GBS, but the problem of GBS, when you enter to inside the rooms in the hospitals, the signal it's gonna disappear. So, but with GSM, the signal will still be connected in the application, so we can locate the patient inside the hospital by scanning the QR code. Then after that, it's gonna by the GSM, it's gonna show us in the map that we have designed where to see exactly. This is the point, the main point of the project, because during this COVID-19. The lacking of the patient, and we cannot we have to make the standard of the patient itself and how to recognize them inside the hospital. So we create this application to how to say, to recognize them and see where are they exactly in which room and which part in the hospital. And this is,
Right. Okay. In terms of the cost for the installation for the system, did you kind of have a study about the budgeting that hospital need to add on for this?
Actually, for the cost, we have still in process for. We made a simple study. So for the cost, the QR code and the GSM, it's the most cheapest method that we can make it. So we have developed a code, two codes using Python as well, one for the QR code and one for GSM. So we compare it in one code. So we have tried this application in preliminary setup. So it's not yet really able to use. We still in development, but you can say 90% of the application is ready, and the accuracy is about 95 in the application itself. We have tried in 2 rooms in our faculty in UTM, in VO1 buildings, and also in eLife solution. Using this method, and it's working, and we hope to transfer it to the hospital in previous days because of lacking of the sources that we have and the lacking of moving and the movement inside the area of Skudai or Johor. It's very difficult for us, so we have do it in these 2 rooms that we can enter on it. I entered before the MCO. After MCO, I couldn't go to do again experiment on it, but I can the codes. It's working well. Everything as well. It's working good.
Okay, and the main purpose to detect people by their location, is it for the hospital to better utilize the room, or is it to detect in order to easy to detect which one patient where and doctor if needed in emergency or things like that? What is the main purpose of this detection?
The main purpose is 2 points. The first point is it's because of COVID-19, as you know. It's we have to maintain the patient and the staff inside the hospital. We cannot bring anyone. So by this application, once the patient or staff come, he can like scan and we can locate where is him exactly. Like if there is a lacking of people inside a room, directly we can solve this problem by seeing inside the application that they got lack. This one is the first purpose. Second purpose, we can control the patient where he must go by this application. So like examples of a patient want to go to the cardiovascular doctor example. So we can like manage and show him where he can go and which room the doctor is waiting for. He cannot like make like around the hospital searching for room or something. We cannot. He cannot do like that because the
okay, for direction, yeah, direction.
Yeah, exactly, the direction, and because COVID-19, as you know, it's.
Thank you, Hassan. Time's up. Okay, thank you. Good answer.
Thank you, Hassan.
Welcome.
Wow, very interesting. Yeah, very interesing. I'm interested on the GSM. When you have the GSM, for sure you will go for the geocoding, isn't it?
Yeah, exactly. We are going to
I think you need to be very careful on the geocoding when they involve the what's called the uniqueness of the coordinate, the attributes. I think that is you need to be very careful on that. All right. Okay.
Yeah, sure, bro, sure.
All right,
Also,
thank you.
I would like to thank all of you, Prof, and sorry for the lacking of the time.
No problem. Very interesting. This is a very good discussion. All right, that's good.
Thank you
All right,
very much.
good.
Thank you.
Okay, now we goes for the the last presenter, isn't it? Oh, the last or the second last?
The last.
The last one, isn't it? The last one actually, the Mr. Abba Khairi Buba. Okay, the titles for the presentation is the opportunities and challenges for green IT. All right, is it Abba is here? Okay, we can start now.
Yes, I'm here. Assalamualaikum.
Okay.
Thank you for this opportunity to present at your conference, International Teleconference on Technology and Policy for Supporting Implementation of COVID-19 Recovery Plan in South Asia. My name is Abakari Buba, a PhD Information Systems, School of Computing, University Technology, Malaysia, with title Opportunity and Challenges for Green IT. Environmental sustainability is becoming a critical issue for many organizations across the globe. IT life cycle from production, use, and disposal has a negative impact on the environment. IT is a major consumer of energy, contributor of US emitter of greenhouse gases such as CO2. According to the Global US Monitor 2020 report, as a result, many countries face a significant environmental health problem as a result of poorly management waste equipment known as e-waste. Moreover, the way we manufacture using and disposal of e-waste, on the other hand, is unsustainable. And on the other hand, in unsustainable problems such as energy consumption and greenhouse gases emission are increasing. Global ICT electrical consumption in 2018, 10% energy consumption projected to be increased by 2030. The global consumption will be around 20%. ICT energy consumption growing much faster, doubling by 2030. Greenhouse gas emission from the ICT industry is about 2% in 2007, projected to be increasing 14% by 2040. Global e-waste generation waste was 6.5 million ton in the 2010. E-waste generation reaching 49.8 million ton in 2018, projected to be increasing by 2030, 74.7%. Research question: what are the main applications of the green IT in organization? What is the issue of IT on the environment? What are the opportunity and benefit of the green IT practicing? IT operation are challenging by some issues still facing period of the global health crisis, COVID-19, electric energy consumption by cyber, computer, monitor data, communication, equipment, and cooling system for data center is suddenly increased as a result increasing the greenhouse gas emission. IT is difficult, facing so many challenges. Services deliver and cost is increasing the cost of system and networking operation, explosion in the volume of data and information, difficult in deploying a new application, energy requirement, energy raising and cost raising and energy demand mandate for the sustainable and management, business and quality security of asset and your client information, cooperating with the regulation as becoming a landslide, system and application need to be available. The great news is there are major capability in the technology and use behavior, and IT can significantly contribute to the can contribute to control and reduce the 98% of the carbon dioxide emission caused by other activities in industry. Getting started with green IT. What is green IT? Start with manufacturing, producing environmental friendly product, and encourage IT department to consider more environmental options like visualization, power management, and proper recycling habits. Use less energy, recycling and reuse the material, reduce the waste and pollution, preserve the natural resources. Green IT or opportunity benefit improving in the sustain your IT operation infrastructure. Earlier I mentioned green IT deal with the direct effect of the consumption of waste of energy when using the hardware, software and waste. Green IT is a practicing strategy that focusing on the successful and eco-friendly using the manufacturing, designing and disposing of the computer services and related products such as processor, printer, monitor, storage devices, networking and communication system without causing harm to the environment. Methodology of the research, the method we follow in this research by step for the review process. In this research, a systematic literature review approach to investigate the current study, the state of study on the concept of the green IT. This study, will enable a comparison and gathering analysis of the recent study published in the green IT research area. The step review process that we follow identifying the research question, define the relevant database, and defining the relevant study paper, selection, extraction of the data, recording the finding and presentation of the result, step by step, the process we follow in the method of this research. The practicing strategy, this framework, by therefore to reducing the impact of the IT on the environment, we propose the green IT strategy. Green use, the energy consumption of computer and other information system. Green designing the energy efficient computer services and cooling the equipment, and green disposal, reusing the old computer and proper recycling the other electronic equipment, manufacturing the electronic element of computer and no impact on the environment. By focusing those forefront, we can achieve a total sustainability from the IT to make IT green without their entire life cycling. Therefore, to reduce the impact of the IT on the environment, we propose the green IT strategy to implement. Contribution and future research. This study contribute practical strategy for IT practitioner, decision maker, government organization, policy maker to understand the opportunity of the green IT to meet the global demand towards the green sustainable development, and also can help the IT industry policy maker to successful green IT. Future researchers study in related environment on green IT in various sector research to investigate are still possible. In addition, looking into overall impact of IT on the environment. It will be a contribution to the academic study on green IT via practical result. Together, sustainable the future. Green IT environmental sustainability that is a developed and in use in a way to that protect environment resources. And then this study found that green IT is a technology that utilize not just promoting the sustainable and reducing the greenhouse gas emission, but also to provide a solution to the climate change. Thank you so much for listening to my presentation. Jazakallahu khairan.
Okay, thank you, Mr. Abba. Okay, very interesting on the green IT. Okay, now then open for the Q&A. Is there any questions from the audience? Everyone can type in if you have. Okay, that now is maybe as usual, Prof. Hayati goes to you.
All right, thank you, Prof. Okay, thank you, Abba. I would like to know how this research is going to contribute to pandemic COVID-19.
This research, Assalamu alaikum, and thank you for giving me this opportunity. This research will help the entire IT practitioner to adopt green IT in terms of maintaining the electricity consumption. When they are practicing, then it will reduce the greenhouse gas emission causing, and then to handle how to manufacture into the disposal of the computers and other electronic materials from the around the world. So this will be a very good opportunity to the IT practitioner. Thank you so much. I hope I answer your question.
Yeah, that is very general, yeah. Not only for, it is not meant for the COVID-19. It is actually for the environment, yeah. When we talk about green IT. Green IT, is that the standard that people use from your literature review or from your background study?
Yes.
Okay, and then the focus is about the carbon emission, things like that. Electric, in terms of the saving, yeah, consumption of the electricity. What is new things that you're going to discover for this? What are the new things? Opportunities and challenges. What do you mean by that? What that you're focusing?
The opportunity, green IT is associating with the films of system product and manufacturing process that use less energy, recycling, reuse the materials, reuse the waste energy, waste used, and pollution, preserving the natural resources. And then the benefit of the green IT could be different in other implementation of IT, other ITs, because of the importance of eco-sustainability, considering the decision makers to process. Moreover, and IT activities have some financial and other advantages through the green IT for cooperating and individual utilizing the green IT that support them financially IT. Thank you.
All right. So I hope all the important points you have it, yeah, in your documentation or during your presentation, right?
Yes.
Because nowadays, during this challenging pandemic, we know that we are moving into the digital platform, right?
Yes. Yes.
So more on this engagement, yeah?
Yes.
So you need to really focus, yeah? What you meant by that, what is the direction, what are exactly the contribution? Because this type of research is nothing new about this, yeah? But what it is actually the future direction, because more and more people in the world are connecting as you know, as one in the globe with this IT. Yeah?
Yes.
So more clearer in terms of what is actually so important about your research in order to contribute to this. Yeah.
Yes.
Are you finding like opportunity, new solution, as you mentioned just now, the material use, or how? What is actually the parameter that you use, or the measurement, or is it any factor or attributes related to this opportunity or challenges just now? Okay, do not make it too general, but it must have a very specific, based on what problem actually that you want to solve. Therefore, you're going to derive on the objectives of your research more clear. Okay.
Okay.
All right. Other than that, because to me it is general, not that specific, and I could not relate actually what is the impact towards the COVID-19 with this particular research, even though we know the importance, towards green IT. Okay, because the trend now it is more towards that,
This research probe is opportunity for the IT practitioner, even at the hospital or any organization. They have IT practitioner that they will go into practicing the green IT so that to reduce all this electricity consumption, server, computer, monitor and communication equipment and cooling system, the data center. Sadly, period to this COVID-19 is increasing because of the demand of overusing. So we are suggesting this green IT practitioner to reduce all this carbon emission. Because recently, if you see so many countries now, so many flooding, even though this also is part of the helping to reduce the carbon emission, it's very important also, not only the COVID-19. This carbon emission also cause a lot of health problems. There is, according to the Global Waste E-Waste Monitor 2020 report, as a result, many countries face significant environmental, human health and problems as a result of poorly managing the equipment and e-waste. Moreover, the way we are manufacturing and using disposal of the e-waste, on the other hand, is not unsustainable, because when you go to each organization, they have so many equipment for electronical, and they have to handle it very.
Okay. Thanks, Mr. Abah. All right. Thanks, Prof. Hayati. It's a very good argument. Questions. I think the question is actually very interesting when to see how the green IT can relate to the COVID-19, isn't it? How you want to relate it? I think that's very good questions, which is we need to see about the inclusiveness, the resilience, the sustainability toward the COVID-19. I think very interesting. Okay. Now, I think it's finished. That's it. Anything else? Oh, I think that's it. Finished, isn't it?
Yeah, thank you, everyone. And special thanks to professors, doctors, presenters, and audience. Now it's the time for the photo session. But before that, I would like to remind everyone in the room to fill in the registration form in the chat box. And then please, everyone, open your cameras and smile for the photo session.
Okay, Asil, can you remove the share screen first? Okay, there are 2 slides. I will take photo for the first slide. Everyone ready? 1, 2, 3. Okay, the last one. 1, 2, 3. Okay, thank you, everyone.
Thank you.
Okay, thank you, everyone, for joining today.
In the form of this evaluation, where to submit?
There is the form, the assessment form.
Yeah, from the panels, yeah.
I will contact you, Doctor.
Definitely. Thank you. Thanks. Yes.
So thank you, everyone.
Thank you.
Thank you. Stay safe. Bye-bye.
Thank you. Bye.
Have a good day.
Okay,
Don't
bye.
forget to fill up the link, yeah.
Yeah. Thank you, everyone. Take care. Bye.